Good morning, everyone. Happy July, and welcome to today's special EHE Regional Learning Collaborative session featuring EHE updates from our state and county partners. My name is Elena Rosenberg-Carlson, and I'm the EHE coordinator here at the UCLA Center for HIV Identification, Prevention, and Treatment Services, or CHIPS. In the chat, if you could all please select the option to send a message to all panelists and attendees, and then use that option to introduce yourself to everyone here on the line by sharing your name, your affiliation, and your location. So those of you who have been with this EHE Regional Response Initiative since the beginning may remember hearing early EHE planning updates from state and county partners at the January 2020 in-person meeting, and another round of updates also at the September 2020 Learning Collaborative session as plans were being finalized. I'm very excited for our session today, which will feature key successes, lessons learned, and upcoming EHE activities as our state and county partners reflect on their first 6 months of implementation. Next slide. So here is our session agenda. We have some wonderful speakers joining us, both from the California Department of Public Health Office of AIDS, as well as all of our EHE Phase 1 counties here in California. During the session, please feel free to submit questions at any time using the Q&A function on your Zoom control panel. Since we do have such a packed agenda today, we'll continuously be answering questions directly in the Q&A box throughout the session. And then we also do have a bit of time reserved at the end for live Q&A. We will also keep the chat function open in case you'd like to share any comments or resources with the group, but please do use that separate Q&A function to submit questions to help ensure we don't miss any of your great questions during the session. As usual, we are also recording the session, and we'll post the recording and slides on our EHE Regional Response webpage within the next week. Next slide. So now I'm excited to introduce our wonderful partners from the California Department of Public Health Office of AIDS, Ending the Epidemic Project Manager, Kevin Sitter, and Research Scientist 2, Allison Hargraves. Welcome, Kevin and Allison.
Thank you.
Thank you.
So I'm going to begin by sharing a little about the California Department of Health's work on ending the epidemics. And then we'll have Allison sharing a little about the Take Me Home project and the results that I've seen so far. And then you're going to hear from each of the counties who have been really on the front lines and digging in deep and hard in year 1 of the Ending the Epidemics federal initiative. So next slide, please. As I said, you'll hear the details about ending the epidemic year 1 from each of the 6 Phase 1 counties. The role of myself and the Office of AIDS is to be the liaison between CDC and the counties. We're also the primary evaluator, and luckily I have Allison Hargraves as my research scientist. She sweats the details. It's really critical for doing evaluation. And we're currently working to develop EPMP, the evaluation plan monitoring plans for each county. We're working with the Building Healthy Online Communities with their successful Take Me Home free HIV kit distribution. And for that, we facilitated funding for our pilot with oral test kits through general funds of the Office of AIDS. And then we also worked with the counties to use some of their Ending the Epidemic dollars for the next phase, which will be dry blood spot with some combinations there. We've assisted the counties and will continue to assist the counties in integrating the Take Me Home test kit options within their interventions. And we are reporting, by we, I mean Allison, is reporting on the data for the 6 counties in an aggregate cumulative way. We also are working with the semi-annual and annual reports, and that is mostly because of the great work of the Facente consulting team, who have been working with the counties and doing great documentation and will help develop these mid-year and annual reports. And finally, we do the fiscal management. Angelique Skinner is our person with a calculator, and she's been helping each of the counties throughout. The management of the fiscal area for year one has been difficult due to the fact that COVID really impeded ability to do the work. Next slide. So as I'm saying, COVID, the documents for anything besides COVID were put on second tier. And so contracts were slow to come out of the state and get through the counties as well. All the staff diversion has delayed initiation of activities, everything from posting for positions and hiring at the county level through developing and issuing RFPs. Other speed bumps include the fact that we didn't receive our official award announcement until the day before the start of the grant, so we could not do a lot of the internal preparation for the contract, and that delayed us. And then several have mobile van initiatives taken underway. And for that, the CDC said the counties could purchase the vans, but not the state. But the state said the state would not purchase the vans, it had to be the county. So we went with leasing vehicles as the option. Again, the Vicente Consulting Group did a lot of research for this and provided each county for their procurement information on various companies that could lease. COVID has depleted the stock of mobile medical vans, and so most of the vans will have to be built from the ground up. The benefit of that is that people can customize, and most people will have 2 exam rooms, a workspace, a restroom, and potable water. So there is some benefit to that. Next slide, please. And so in addition to the federal initiative, the state has been working through its current integrated surveillance, prevention, and care plan that HRSA and CDC required. That time frame was from 2016 to the end of this year. And they've now issued instructions for creation of a new integrated prevention and care plan. They have given us more time, so it's not due until 2022. And the benefit of this is that the CDC is now recognizing there are multiple plans throughout the state, and that some of those plans can be used to fulfill requirements in the 2022-2026 integrated plan. Next slide. So the approach that we're taking at the Office of AIDS with this STD control branch is to appreciate the syndemic of HIV, STIs, and HCV. And so we have a team developing the plan that includes community representatives from the Ending the Epidemics Coalition and other representatives, and with the facilitation skills and writing skills of the Vicente Consulting Group, who's done many different plans. We're appreciating the intersectionality of racial health equity, social determinants of health and HIV, STIs, and HCV, and that will drive our plan, which will also use harm reduction principles. We need to affirm the needs of people who inject drugs and people who use drugs, with an emphasis on ending overdose deaths, as well as ending new HIV infections, new HCV infections, and changing the direction of STI rates. Next slide. So we're dividing creating the Ending the Epidemics plan into 2 stages. This year, we'll do the mission, value, vision, and goals. We've been asking subject matter experts to come forward and share with us information for us to guide our social determinants of health. We're seeking community input through many different means: surveys, key informant interviews, input through statewide Ending the Epidemics Coalition. If you have a community group, a Part A planning council, or another consumer group that you'd like to be able to give input for this, the Vicente Consulting Group is willing to meet with your group and to do some focus group work and listen for what they would want in a plan. So please reach out to me if you'd like to have them provide information on or to receive input. We'll have a public comment period of the draft before it's finalized, and then with that final input from the public comment period, we'll release the mission, values, vision, and goals in December 2021. Next year, we'll work on the objectives directing the activities to achieve the goals that were outlined. OA and STD control branch staff will help in the development of the objectives. Assuring compliance with HRSA and CDC will be part of that, and will be consistent with other plans throughout the state, including the Ending the Epidemics federal plan, Part A plans throughout the jurisdictions, getting to zero plans. And so we'll want to make sure that we're in tandem and not in conflict. And lastly, there'll be ongoing community input throughout the development of the objectives and review periods before the objectives are finalized. Next slide, please. So as I said, we're currently seeking input. There's a 7-question open-ended survey currently online at that SurveyMonkey address you can see. The survey is available in English and Spanish. We really want input from everyone: consumers, people who are PrEP eligible, family members of people living with HIV, you as providers and people working in the field. And so please, we encourage you to take the survey. It can be as short and as long as you want it to be, given the fact that there's open-ended questions. The survey is open through August 31st. If you have any questions, feel free to ask me. We are looking real time at survey results. So every week we get an update of what was shared in the previous week. So please know that as soon as you provide your input, we'll start working with it. So that's what we're happening at the Office of AIDS. We've got the Ending the Epidemic's federal initiative that we're assigned to work with. And we also have our new syndemic approach, strategic plan development. Next slide, please. And so now Allison's going to share with you that Take Me Home activities and the results of that. Allison?
Thanks so much, Kevin. Hi, everyone. So as Kevin mentioned, we at the California Consortium of 6 counties have been implementing a pilot phase of the Take Me Home BHOC, Building Healthy Online Communities, self-test kits. And so I'm going to be sharing some of those initial results today from tests that were ordered between September of 2020 and June of 2021. Next slide, please. Okay, so this slide is just showing us how many folks have ordered and from which of the 6 counties. We've had a total of 1,651 counties in the 6 California Consortium counties. I do want to mention, I know San Francisco and Los Angeles counties are also doing Take Me Home BHOC tests right now, but for this presentation, I only have data from these 6 counties, and the remaining data will be all in the aggregate. So you can see that we have tests going out to all 6 of the counties, and the counties so far with the biggest number of orders have been Orange and San Diego. Next slide, please. So we don't get a ton of data. BHOC is really trying to keep the barrier of test ordering low, but we do get some demographic information about folks ordering tests. So this is a slide showing the age of individuals who have ordered tests so far, and you can see that even though we do have a pretty wide range of ages, definitely the most orders are coming in from young individuals. Next slide, please. And here you can see the races and ethnicities reported by participants. And again, we can see that we're getting to a wide variety of groups, but our biggest group that's been ordering test kits have identified themselves as Hispanic or Latinx. Next slide, please. Okay, so this slide is taking a look at gender. I do want to mention there is a sex at birth question that is required. The gender question is not, but this is the one we're going to look at right now. So if you're familiar with the BHOC program, you might know that they do advertisements. That's one of the great things about the Take Me Home program, is that they are doing their own advertisements on gay dating apps. And you can see that definitely most of our individuals are identifying as men, but actually about 1/10 of our participants are identifying as women. And then I just want to mention for this another gender, folks are invited to write in a gender that may not be represented. And the biggest group that we've gotten written in is non-binary individuals. And next slide, please. Okay, so this slide is a little bit more complicated, so we're going to look at it in steps. So one of the questions that's asked and is actually involved in being allowed to order a test is when an individual was last tested for HIV. So you can see that the majority of individuals who are ordering a test report not having tested in over a year, and some are reporting having never tested. That's the requirement for right now, is that individuals need to not have tested in over a year. Can we have one click, please? Thanks so much. So we see here that 43% of individuals report never testing and 56% have not tested in over a year. So this is of the individuals who have ordered a test. Can we get one more click, please? Thanks so much. So I'm going to go into more detail in just a minute about our post-test survey. It's not required, but the same question is actually asked. When was your most recent HIV test before this one in the post-survey? We've had 229 individuals who have filled that out so far. And in the post-survey, there actually are other options for having tested within the past year. And can I have one more click, please? Thanks so much. So you can actually see that about a quarter of participants who have filled out the post-test survey report having tested within the past year. So it's a little bit different from our order form. So it is possible that folks are moderating their responses when they're ordering a test so that they're eligible to order a test. But we can still see, 75% of our participants are reporting, even in the post-test survey, that they have not tested in at least a year. And actually 28% of individuals who fill out the post-test survey are still saying that they've never taken an HIV test before. And next slide, please. Okay, so I'm gonna talk a little bit more here about our post-survey. So as I mentioned, 229 individuals have filled that out so far. Again, they're from all 6 of the California consortium counties. And the post-test survey is a really nice way for us to get a little bit more information. A link is emailed out to participants about a week after they've been sent their test, and folks are invited to respond. And next slide, please. Okay, so our main outcome of interest, of course, is what was the result of your in-home test. And so far we have had 2 people who report an HIV positive test result for their in-home oral test kit. And so those folks are asked follow-up questions, including, did you go to seek confirmatory testing? Both of these individuals did. One of them actually reported that their confirmatory test was negative, so it was a false positive at home. The other one did report that they did receive confirmation that they were HIV positive. So out of our 229 individuals, that one HIV positive, the 0.4% positivity rate. And then I do want to mention these 45 folks who are missing. Folks don't have to have taken their test already before they complete the post-test survey. And actually, I did check on these guys. These folks had reported not taking their test yet. Okay, next slide, please. Okay, so this one I think is pretty interesting to look at. This is a question that asks about risk factors, and respondents are invited to check all that apply. And what we can see here is that by far the risk factors that are the most common for folks is that they are, of folks who are responding to the post-test survey, is that they report being a man who has sex with other men. That's about 3/4 of our participants, and then having had more than one sex partner in the past year. That's about 61% of participants. But you can see that we do have a variety of other risk factors going on. So my sex partner has HIV, I receive treatment for hepatitis or tuberculosis, I inject illicit drugs, my partner injects illicit drugs, or I've been diagnosed with an STI in the past year. So we are actually getting our tests out to folks who have a variety of different things going on in their lives. So just kind of in summary, Take Me Home is really allowing us to get test kits to folks in all 6 of the California consortium counties of really diverse backgrounds. A lot of counties had included in their plans, and you'll hear about that more when they speak in just a minute, but a lot of them had included that their populations of interest for ending epidemics included young adults, MSM, people of color, and Take Me Home is in fact getting tests out to those groups. So our main limitation at the moment is that we are not receiving test results for those oral swab tests unless folks do fill out this post-test survey. But as Kevin mentioned, upcoming, Take Me Home is going to be introducing dry blood spot tests where they're going to be sending them into laboratories. So we are looking forward to being able to have more outcome data in the upcoming years. So that is it for me. Next slide, please. Okay, great. So I'm going to pass it back to Kevin. Thank you, everyone.
Thanks, Allison. It is an exciting project, and we really appreciate the work that Building Healthy Online Communities has done. They've affected the change of online work with men who have sex with men. So now you're going to hear from each of the California consortium counties. And as I transition over to them, I want to just share my admiration and appreciation for all the county staff. you need to remember that in addition to PS 2020-10, they're working on 078, the other HRSA ending the epidemic work. They're working on their Part A contracts, their Part B contracts, their CDC 18-1802 prevention contract. And so I just want to remind everyone that people are really multitasking, have lots of different assignments and lots of different funding sources to be responsible for. And all of that, we add COVID to the mix. So I'm very proud of what they're about to share with you about their successes, what's coming next, ongoing partnerships, and the key lessons. So Elena, please feel free to go forward.
Thank you. Thank you so much, Kevin and Allison. So first up from our consortium counties is Steve Gibson, Director of the Office of HIV Prevention at the Alameda County Public Health Department. Take it away, Steve.
Good morning. Thanks so much, Ellen. Next slide, please. So one of the things that we did, in Alameda County, we identified our priority populations as being African-American and Latino, gay and other men who have sex with men, young MSM of color, transgender people, and specifically focusing on transgender women and women of color. Those have been existing priority populations for us, as Kevin mentioned, for 1802 and are continuing with our 2020-10 grant. We did an RFP process with the funds from 2010, and we were able to go through a competitive process and award funding to the AIDS Healthcare Foundation, Bay Area Community Health, or BAC, formerly known as Tri-City Health Center, and East Bay AIDS Center, or EBAC. We completed that process just during COVID, actually. Services that are going to be funded under the 2010 grant initiative include, broadly speaking, focused testing for our priority populations, routine opt-out testing, and as Kevin mentioned as well, and also mentioned self-testing. We focus on it self-testing rather than in-home testing because not all people we're testing have houses. We're also using social network outreach as part of the strategies. Specifically, EBAC is going to be hiring young gay men as PrEP navigators. So young gay men who are on PrEP and offering PrEP navigation through that and offering incentives as well. We're really focusing on young people. We see in 1802 funding that most of the people who are accessing testing services are not young folks. So we're really focusing on trying to make sure that young people have access to HIV testing. And we've seen that very specifically with self-testing that's being done with building healthy online communities. When we compare the data from self-testing there compared to the data from sites that are doing focus testing, BHOC testing is reaching younger people and people of color. And we have specifically Bay Area Community Health, or BAC, included a job training program for transgender women who are currently sex workers and is offering job training program as part of bringing people into the workforce. AIDS Healthcare Foundation is going to focus testing out of their AHF Wellness Center out of the Closet Store in Oakland. They're going to be expanding to include Saturday hours as part of this initiative. Bay Area Community Health, as I mentioned, is doing the job training for transgender women, and they're offering routine opt-out testing in clinics in the south part of the county that are not currently doing HIV testing. So part of BAC is currently doing routine opt-out testing, and they'll be expanding over time to include different sites that are not currently doing routine opt-out testing. And as I mentioned, EBAC is going to be doing their PrEP navigation with young young gay men who are on PrEP. And we're really focusing on same-day PrEP initiation. And by initiation, we're talking like pills or prescriptions in hand, specifically asking people to initiate PrEP when they leave the site. Next slide, please. We are hiring additional staffing with this grant. We're going to be hiring a program specialist and a public health investigator at the county. Those positions specifically are going to help with the rolling out of self-testing. As Kevin mentioned, we're currently doing the oral fluid testing, but we're going to expand to include HIV dry blood spot, multi-site gonorrhea, chlamydia, syphilis, and HIV dry blood spot, and creatinine for PrEP maintenance. I have a question for those of you who are doing this, if you're going to look at using PrEP initiation with the creatinine test, or if you're going to be focusing on PrEP maintenance. We're expanding our CBOs doing testing and PrEP services. We specifically find that when trying to get agencies to include routine opt-out testing, that the data entry components of that is daunting. Many of the agencies that we fund are smaller and don't have the support that they need to manage the data analysis or data entry. And we're also looking specifically for help with getting pharmacy access of PrEP. We know that it's there, but finding a way to try to actually get it, get pharmacies engaged is where we're kind of struggling now. We are partnering with East Bay Getting to Zero and their summer promotion for self-testing. They're calling it East Bay Love, East Bay, B-A-E, Love, where they're promoting self-testing. Facenti Consulting is going to be working with us on doing key informant interviews with young gay men of color who are not engaged in HIV prevention work to see what's of value to them. And Facenti will also be working with us to work with agencies that are working with previously incarcerated populations. Next slide, please. So our long-term partnerships include Office of AIDS, the California Consortium, CHIPS, the Fast Track Cities, East Bay Getting to Zero, in terms of both their linkage network as well as their prevention network. And ongoing focus planning is happening with East Bay Getting to Zero. We find that it's much easier to contract with them because they're more nimble than we are. And getting their East Bay, for example, getting their East Bay Love campaign out is something that we, the health department, would not be able to get off the ground. And we're doing ongoing community engagement focused on our priority populations. Next slide, please. So one of the key lessons that we've learned is that public and private partnerships allow for flexibility and responsiveness that local health departments and community-based organizations alone cannot provide, and reach people who are not reached by current prevention methods and strategies. When I looked at the data specifically around the self-testing, and the agencies that we fund for focus testing, we keep encouraging our agencies that we fund to try to reach younger men and younger men of color. And what we find is that they just haven't been able to expand their network to reach this population, and that the self-testing that we're offering really is reaching a population of people who are not accessing testing. And that the fact that Building Healthy Online Communities is doing the advertising on the gay date sites, something we couldn't do, and we're getting self-test kits delivered to people's hands who wouldn't be seeking out testing prior to COVID and wouldn't be seeking testing during COVID. That's it.
Wonderful. Thank you so much, Steve. I did want to note that we're getting a couple great questions coming in both to the chat and the Q&A box. And I just want to make sure folks have the opportunity to add those questions in specifically to the Q&A box. You should see the Q&A function with those kind of two speech bubbles on your Zoom control panel. That way we can make sure that we don't miss any questions that might come in between comments in the chat. So please do continue adding to the Q&A box as you have questions throughout the session. And next up, we have Matilda Gonzalez-Flores, Program Manager for HIV Planning and Coordination at the Orange County Healthcare Agency. Welcome, Matilda.
Hi there, everyone. Thank you for giving me the opportunity to share a little bit about all of the great work that's happening here in Orange County. Next slide, please. All right, so I'm going to start by highlighting some of the key accomplishments from year one. So I'll go ahead and highlight or speak to some of the work that's been happening to facilitate our efforts around community engagement, and specifically on relationship building with priority populations, and really those that have been disproportionately impacted by HIV in Orange County and have had limited access to HIV care and prevention services. Specifically in year one, we focused on engaging the transgender Latinx community, and community engagement efforts focused, thus far have been focused on needs assessment activities. So for example, service groups, PrEP education, surveys, PrEP education, and we're also in the process of planning some focus groups. And again, the intent or the goal of our community engagement activities is to be able to inform service delivery in Orange County. And as part of that work, a contract was awarded to Alianza Trans Latinx, which is a transgender-led community-based organization here in Orange County, serving the transgender community, and specifically transgender people of color. So that was a partnership that a new partnership for the county to facilitate and accelerate our work to reach disproportionately impacted populations. I also want to highlight the work of the Integrated Plan Committee. And the Integrated Plan Committee is a subcommittee of Orange County's HIV Planning Council. And they serve as the steering committee for all EHE related work in the county. They have been integral in developing and informing new and innovative strategies to fund and implement with EHE funding, and really look at the initiative or the effort across the board. So not just focusing, to also include and to also consider HRSA EHE funding, for example, in addition to CDC funding, as well as other funding from the state, for example, 18-1802, so that it's a comprehensive approach as we work towards ending the HIV epidemic. I also want to highlight some of the programs and services that have been implemented or were initiated in year one in Orange County. And really, in year one, the focus was on county-led in programs and services, and specifically the county HIV clinic took the lead in implementing a couple of these programs and services that were implemented in year one. So I really want to highlight and point out that tremendous work. So the first program was the Mail to Home Test Kit Pilot Program. So it was, as was referenced earlier, this was in partnership with BHOC, the Building Healthy Communities Online. Currently, HIV testing is being offered through BHOC, but the county is looking to expand their testing offerings to include STD testing as well. So that's certainly coming in the next couple of months. Another program that I want to highlight that was initiated in year one is the Viral Suppression Patient Incentive Program. So again, this is a brand new program that is being initiated, and this is in partnership with community-based providers with high volume of individuals who are not virally suppressed, and offering incentives to these individuals to achieve key milestones to be able to ultimately achieve viral suppression. And something I think that is important to highlight or call out here, that these are partners outside of the Ryan White system of care, because we have seen that we see poorer health outcomes in terms of achieving viral load suppression for individuals outside of Ryan White. So again, really honing in on focusing in on where we see those gaps along the HIV care continuum. So that is the focus of that particular program. Sort of in partnership or going hand in hand with the Viral Suppression Patient Incentive Program is the Community-Based Case Management Services. Again, really focusing our efforts to engage individuals outside of the Ryan White system of care and providing that support in order to be able to achieve viral suppression ultimately. And lastly, I'll highlight is PrEP navigation services. So putting that infrastructure in place to be able to offer those PrEP navigation services to the community. And I'll highlight that the county HIV clinic was able to, in the last couple of weeks, implement a training around PrEP navigation services that engaged not only county staff, but also community-based staff around PrEP navigations. And it was really tailored to meet the needs of providers in Orange County. And that was in partnership with the California Prevention Training Center and UCSF. And lastly, I'll call out here in terms of staffing, we have been able to engage some key staff to support the programs and services that I've detailed so far. Next slide, please. All right, so what's in store for year two? So there's a lot of work to be done, a lot of things we have planned. As I mentioned in the prior slide, the focus was in year one on getting county led programs and services up and running or initiated. The focus for year 2 really is on procuring community-based programs and services. So that entails mobile testing, care, and referral services for priority populations, which in Orange County are MSM, injection drug users, and individuals with who have history of incarceration. So that is one group of services that we will be working towards procuring in this year 2. Also implementing health summits for gay MSM population, as well as for the transgender population, as well as community-based PrEP navigation services. We will absolutely continue to, and this is in addition, of course, to continuing the work initiated in year 1. In terms of community engagement efforts, we will also focus on engaging the Black or African American population in Orange County, because we know that although they're a small population in terms of numbers here in Orange County, this community continues to be disproportionately impacted by HIV. And we also hope to continue our community engagement efforts through the health summit, surveys, and focus groups. Next slide, please. All right. And as part of our work, again, we're looking at this comprehensively, really, and across the board. We can hope to continue to work with all our regional partners, including the State Office of AIDS, the California Consortium at the state level and federal level, but also our local partners here. So including our HIV services providers and the Integrated Plan Committee, as I mentioned, and certainly consumers that are involved, not only with our planning council, but in other different organizations and community-based groups. Next slide, please. All right, so in terms of lessons learned, I think something that really resonated in coming out of this year 1 and moving into year 2 of this EHE work is that collaboration and community-driven programs and services are key. That has been front and center. And collaboration, I want to highlight or point out that it's not only, it means a couple of things. So certainly collaborating with consumers, collaborating with community-based organizations, but also collaborating with internal stakeholders. I think that really resonated as we worked across departments to be able to move a lot of the county-led efforts forward in this year 1. And lastly, I'll offer this little nugget for my colleagues in the different EHE local health jurisdictions. I want to also commend and applaud all the fantastic work that's happening across the board, because I know that we all wear so many hats, and so I will just say, just keep swimming. You know, the proof is in the pudding here that so much fantastic work has been taking place despite, you know, what seems to be insurmountable challenges at time. And I look forward to hearing all the great updates from my other colleagues. Thank you.
Wonderful. Thank you, Matilda. And thank you. I'm glad you cited Dory. Always crucial to cite your sources. So thank you for that as well. So now we have Carol Barrera, Program Coordinator 2, managing the Ending the HIV Epidemic activities for the HIV STD program at Riverside University Health System Public Health. Good morning.
Right, good morning. Good morning, everyone. Thank you for having us. So next slide, please. Thank you. So much like the other counties, we have a very strong focus on specific critical populations, and some of those are MSM of color, especially if they identify as belonging to the Latinx and African American communities. We have a strong focus on persons under the age of 30 and trans people as well. We are currently in the process of completing our RFP with our 2 CBOs. One of them being Palm Springs Test out in the desert area. And then one of the ones that we're very excited about is FLAC. We don't have as many services as we currently do in the desert and the other areas of the county. So we're very excited to be working with this new partner out in the HEMA area who's going to be really helping us push forward all of our EHE initiatives and really support us in community engagement and just increase our testing capacity as well. We have filled a number of staffing gaps. And so we have a program coordinator on board, senior CDS on board, is a health educator who is really working with our health ed team. We're very excited about that because we're increasing our outreach capabilities as well. We have a nurse practitioner who is currently going to be coming on board next month. They're going to be spearheading our PrEP assistance program. And then a health admin assistant who's really going to be supporting us with all of the administration at the clinic for the PrEP AP program. We're very excited about some of our innovative strategies. Like I mentioned, we're really focusing on increasing our testing capacity, whether it's with our CBOs, being strategic with the CBOs, depending where they're located out in the county, getting our mobile unit out, working with our health ed team, whether they're under EHE or our prevention staff. Participating in just any outreach activity that we're able to work with, and also working with other county departments to increase that our testing capacity. We're very excited to be launching our PrEP expansion program. This is something new for our county that we're very excited to be launching out of our clinic out in the Riverside area. And this is really going to focus on increasing PrEP, but also strengthening our community engagement. This is just another way for us to really bring these services, and especially those that we know we currently have gaps in. We are working with Vicente on a lot of focus testing, whether it's on MSM and trans, and our CBOs will also be assisting us in focus test groups, just so we're able to identify any gaps and increase services where it's needed. We also recently started our rapid linkage to care in our Riverside clinic. We're very lucky to have one of our providers, Dr. Wu, as our champion. So he works part-time in our HIV clinic, but he also works in our medical center. And so he is really able to educate the providers that he works with at the medical center, in the ER, all of the community centers throughout the county, all 11 of them, which is a lot of support because they're able to refer a lot of clients to our clinic, to our PrEP program, and we're able to link them to care as well. As far as community engagement, we work with a lot of agencies in San Bernardino County because we're close to one another, and then ROTA, which is our overdose data to action. So they provide a lot of data for us, and we're able to work with them on individuals who use drugs, as well as providing data to find the hotspots where we're able to send our mobile unit and focus our outreach efforts as well. We also participate in special events that focus on testing and outreach out in the community. So our health ed team really works with the gay bars in downtown Riverside and in the desert area. And we partner with them on especially on special events. So whether it's karaoke night, if it's an art walk, because we know they're already helping us with the marketing and bringing individuals to their event. And then we bring in our testing capacity as well. So we're able to really increase our number of testing that way. And it really focuses on educating the employees there. They become our champions and they start inviting us to future events. And we just see that relationship grow, which is very helpful for us in our activities. As far as capacity building, we are working on this. We conducted some already this year, and this is something that we're looking into increasing next year, and that is providing trainings around PrEP, the benefits of it, and providing a full medical screening to patients, to providers under IEHP. And so we started with 2 trainings last year, and then next year we are going to start increasing the number. Our health educator who came on board is also going to be included in increasing this capacity, so we're able to increase the number of providers that attend. And then we are going to start providing an incentive next year as well to also bring additional providers to complete the program. Next slide, please. Additional staffing. So come August, we will have our C come on board. And after that, we will have full staff under EHE. So we're very excited. We've already started implementing a lot of our programs and activities. So having all staff on board is really going to support the CBOs once we get the contracts in place and really increase our capacity and really just get out there and start helping our community. And some of the interventions, like I mentioned, is our PrEP assistance program. This is new to our county and to our clinic. So it's a bit of a learning curve, but we have a lot of support from other CBOs and all of the other counties as well. So we're very excited about this. Another initiative that we're working on is the MSM Night Clinic. And so this is going to be starting once a month in the evenings to target MSM and trans individuals to offer education, rapid testing, linkage to care, and just full wraparound services outside of the norm of 9 to 5. That way we're able to reach them outside of those hours. And then our CBOs will be able to support us during the weekend hours as well. So we're able to offer more testing. As far as community engagement, like I mentioned, we are working on focus groups of trans. That way we're able to identify additional gaps and bring more services to that population and ongoing community engagement throughout the rest of the county. Next slide, please. As far as regional partners, we work very closely with CHIPS, CDPH, and the California Consortium, as well as many other CBOs throughout the county. We have a strong focus on working with our local UCR, CBU, in order to work with the clinics that are already based out of those universities to get outreach out and really to target the younger population as well. As far as tech assistance, like I mentioned, we are starting our PrEP assistance program. And so this is something new that we are starting out of the county and in our clinic. And so we're really looking to just best practices from other counties really that have already established their programs, but really strengthening and setting a good foundation for our program so that we're able to grow it into year 2. So we're focusing on getting all of our EHE staff trained to be PrEP navigators, so we're able to support clients through that process as well. Next slide, please. And then some of the key lessons that we learned as we go through the MOU process and contracts with our CBOs, we hit a couple of barriers. And so it's unfortunate that it took us quite a bit of time to get those contracts in place. But nonetheless, we had a lot of lessons learned, and those being that it's good to have contingency plans because we aren't able to hit the ground running with them quite yet until those contracts are signed. But we really need to keep the momentum and that relationship growing with those CBOs. So when all of the paperwork is finalized, we're able to move forward. We don't want to stop the good work that we're doing under EHE and testing, especially as the county started opening up. We've been invited to a lot of outreach events, so we didn't want to put a pause on that because we weren't able to move forward with the CBOs yet. So we've been filling the gap as best as we can with our mobile testing and been really targeting the outreach events that we have to start increasing that capacity, educating the community, and just letting them know that very soon we're going to have additional staff out in the field with their CBOs. And then as far as just looking to other counties, really, like I mentioned, a lot of us are, we have similar plans in place. And so another county may have a best practice or a different idea on getting through a barrier. So really looking to one another, supporting each other has been instrumental. And I just want to say thank you to everybody for participating, providing information, and just the great work and support that we have with one another. Thank you.
Great. Thank you so much. Now we have Kyle Lafferty, Program Coordinator for HIV STD Prevention at the Sacramento County Department of Health Services. Welcome, Kyle.
Thank you so much. Hopefully everybody can hear me okay. My name's Kyle Lafferty. I am with our Sexual Health Promotion Unit here in Sacramento County. So thank you for taking the time to chat with us today and hear these updates. I'm going to talk a little bit about the work that we've been doing and what we have planned coming up. Next slide, please. Okay, so we'll start with successes. We In Sacramento County, we are planning to launch a Wellness Without Walls mobile clinic as one of our innovative strategies around ending the epidemic. We're going to couple that with home testing. You've heard a lot about building healthy online communities, and we're participating in that and hoping to expand. We are also launching a comprehensive U=U campaign, and that's going to go across all of our Ending the Epidemic funding streams, so we're excited about that. We have a focus on youth-friendly services. We actually just this morning got our contract approved with Metro Health to provide Positive Peers, which is an app that we'll be using for folks, transition age youth living with HIV, through our clinic and Wellness Without Walls program. As far as our priority populations, we are focusing on transition age youth. And we have done successfully, we've had one focus group with them. Sacramento County has a youth advisory board with a focus on sexual health, and we were able to meet with them to do a focus group and got some really great information that will inform our work going forward. For staffing at this point, we have been really lucky that the Ending the Epidemic funds have allowed us to expand our surveillance program, and we've been able to hire some communicable disease investigators. So that's wonderful. And at this point, we're just experiencing, having to train new staff, which is a challenge that I'm sure everybody is familiar with. Next slide, please. So as far as our upcoming activities, we're hoping to continue along the lines of the focus groups to do some additional engagement with our priority populations. And we're going to use those focus groups to evaluate some of our U=U campaign materials and see if we are advancing public knowledge on that. We're hoping to partner with some of our existing community-based agencies who have already built trusting relationships with unhoused communities and people who use drugs. So we're going to leverage those existing relationships to hold those focus groups. We just launched, I believe it was last week, our RFP, or released our RFP rather, and we're seeking 1 to 2 community-based agencies to help us provide wraparound services that will complement our mobile clinic and the other activities that we have planned for Ending the Epidemic. We still are working on filling some of our staffing positions, so we're still looking for a nurse practitioner. Actually, we just made an offer to a medical assistant, so we're in good shape there. And then some of the other innovative strategies that we're looking at this point, we're trying to figure out how to contract to potentially get some mobile shower and laundry services to complement our Wellness Without Walls mobile clinic. We're super excited about that, and I believe that's that's been made possible with some of our carryover funds from year 1. So we're looking forward to that. Our further work with U=U, like I mentioned, and then expanding our home testing or self-testing. Thank you, Steve. I liked that reference. Self-testing options through building healthy online communities so that we can further our PrEP program. And right now, as far as technical assistance, we're working with Vicente to help develop that U=U evaluation, and we're excited about that. Next slide, please. Okay, so we have our ongoing partnerships, our regional partners that we're super grateful for and that we're receiving support from. Then we also have our local Sacramento partnerships, our HIV Health Services Planning Council, our HIV prevention and care providers. So a lot of the community-based agencies that we have existing relationships with, and they are valued partners of ours and provide community-based testing. This past year, we got really lucky and we've expanded that circle to include Sunburst Projects. So that's a new agency that we're partnering with, as well as Sacramento Street Medicine. And we're in the process of getting an MOU completed with them. Next slide, please. So the key lesson learned, I would say for us, if you could even say a silver lining for COVID, when you get a curveball, you just be creative. So we actually, with all the back and forth that Kevin mentioned earlier about the van and the fact that our Wellness Without Walls was our key component of our Ending the Epidemic plan, we realized that it was not going to happen for us to purchase our own van or even be able to lease a van. But we were lucky enough to partner with Primary Health, who had already sort of had the ball rolling on securing a van. And now we're super excited about this collaboration because we think we're going to be able to really provide some more comprehensive care out in the field and serve unhoused communities with more services than before. So it all worked out in the end. And that's it for me.
Thank you so much, Kyle. Next up, we have Cynthia Turk, Health Education Specialist 2, joining us from San Bernardino County Public Health. Thanks for joining us, Cynthia.
Hi, thank you. Good morning, everybody. Like she mentioned, Cynthia Turk with the Department of Public Health, San Bernardino County. Next slide, please. So our plan had proposed a comprehensive mobile unit for care out in the community. For our year one progress, we were able to re-engage our planning council. So that was a good thing because especially with the whole COVID and whatnot, but re-engaging them because we were working on our prevention plan, and we were reporting data to them on a continuous basis, and somewhere along the lines we weren't as connected. So we re-engaged with the planning council so that they could give us their insight and their feedback on this new plan. The next success was that we had a strengthened connection or collaboration with other sections within our department. So our HIV prevention, HIV care, HIV surveillance all fall within different sections of our department. And so to strengthen or enhance that collaboration was a really great success for us as well. However, we were working with them. It was just this stronger bond. Engaging critical new partners. We have engaged behavioral health department. We have the communicable disease was our surveillance, and then the sheriff's office and probation are all now in part of this new plan in one way or another. Another success that we had was our innovative strategies planning was that, again, our rapid response team was to deploy to go out to the desert. San Bernardino County is a huge county, and just going from what we call the high desert down to the Central Valley or where most of the services are focused, it can be a hardship for somebody. It is an hours-long drive. If transportation is a barrier, it definitely is going to be hard for them to get the services. So to have the rapid response team or the mobile clinic deployed out there is in the deserts was our focus. So we started initiating that. We haven't completely gotten the mobile unit yet, but that's one of our successes is the initiation of it. We are integrating HIV, HCV, and STD testing for this comprehensive service. So we are, through the mobile unit, we will be gathering or have a team that can provide comprehensive services. Apart from just the testing or the medical care, there will be some mental care, some support services in that team. The rapid start and prep would also be included. So rapid start, meaning that we could have immediate treatment available to them or immediate prep services available to those who come in and seek the service. Peer outreach, we have initiated our recruitment for the peer outreach. That would be educators, peer educators trained to go out into the community. These educators will be people who have similar background or similar experiences to the targeted population that we are hoping to connect with. Home testing is a huge success. So apart from our regular in-person testing, we will have self-test kits available as well. And that is through a partnership through the Building Healthy Online Communities. And the website there allows somebody to order kits online so that they can do the testing in their own safe space. That would include not just HIV, but it could include HCV, STIs, so that or we could help connect them to that website and help them order it as well. Next slide. For the upcoming activities, we are again in the process. Our procurement process is initiated for the mobile van, along for the community, also the community-based organization. So what we're hoping to do for the upcoming activities is to finally complete that, get our mobile van going, and our team with it. So which leads me to the next bullet point, the staff hiring. The recruitment of the new staff is in process as well. So we will be having the team. We have different partners already expressing interest in our activities and and they want to be involved in assisting or in collaborating so that this comprehensive rapid team is as successful as possible. Other upcoming activities is expanding the use of the self-test kits. So by expanding is that currently we offer the OraQuick rapid test. We will eventually start including the dried blood spot, STIs, HCV, and some tests for the creatines for the prep labs. So some other activities that we will be completing are further community engagement. So we have already completed some e-surveying with substance use disorder partners, and they had given us some great feedback on what kind of HIV services are needed or do they have, what kind of testing is available at substance use disorder agencies or services. And so through that, we will be able to kind of hone down on what is really needed in that collaboration. The next activities would be connecting or doing some sort of engagement or feedback for people experiencing homelessness and those who use drugs. So like a focus group to really get some input directly from the community that we're reaching out to. Next slide. Our ongoing partnerships, again, as I had mentioned, we have a strengthened collaboration internally between the sections that provide HIV services. We have technical assistance providers, CDPH, California PTC, PAETC, and then the Facente Consulting Group, of course, California Collaborative CHIPS, our Planning Council, providers, substance use providers, the connections that we have made there, and then of course through behavioral, and furthermore through behavioral health, housing providers and mental health providers. Next slide, please. So a couple of key lessons learned here is that new territories take more time and more resources. So we are doing something here that hasn't been done before within our program, our section. So we have to start somewhere, even if it's difficult. As Kevin had mentioned earlier, to obtain that mobile vehicle, CDC, again, you have to go through what the funding states. So CDC had stated one thing, and then we got info from somewhere else. So then we will be, so that was kind of hard to go through, but again, we have already initiated it and we're gonna move forward with it. We can do virtual community engagement. And I think this part falls for everyone, all of us. We have figured out how to do virtual communication, virtual meetings. So virtual community engagement with providers. Of course, it is better to connect face to face. But you know, like I had said, we have to start somewhere. New partners have given us new ideas, and so on how to reorganize baseline services. So, so this is something that is a lesson learned that we should, of course, really consider the ideas that are coming from the people who are already in that field, or as the upcoming activity, the focus group. We want to hear from the community partners. We want to hear from the population we're serving directly. And so that they will be connecting us to creating services that are more effective for them. Next slide. Oh, okay. Thank you.
Thank you so much, Cynthia. And now I'd like to introduce Felipe Ruiz, Community Health Program Specialist and EHE Program Manager for the HIV, STD, and Hepatitis Branch at the County of San Diego Health and Human Services Agency. Welcome, Felipe.
Thank you so much, Elena, and good morning, everyone. My name is Felipe Ruiz. I'm the EHE 2010 Program Manager with the County of San Diego Health and Human Services Agency, and I'm excited to share our year one updates with all of you today. Before jumping in the presentation, I just wanted to tell you a little bit more about HIV in San Diego. So even though new HIV cases in San Diego County have been decreasing steadily, and the number of HIV-related deaths has decreased over the last few years, several groups in San Diego County continue to be disproportionately impacted by HIV. They include Black, African American, and Latinx MSM, transgender persons, and people who inject drugs. So the strategies that we are aiming to implement in San Diego County as part of our EHE efforts are intended to be comprehensive and responsive to this local context. They're also intended to build on previous and ongoing innovative HIV prevention efforts implemented across the county over the last few years. Next slide, please. So for this presentation, we wanted to focus on 3 different success areas: engaging critical populations, filling staffing gaps, and developing and supportive innovative strategies. In January of this year, the San Diego County Board of Supervisors lifted restrictions related to the operation of syringe exchange programs in the county. So to support this and build infrastructure to support syringe exchange programs in the county, we've conducted several community engagement events, and we'll be soon rolling out a community readiness assessment to not only inform the development of wraparound services for people who inject drugs, but also understand the current level of knowledge among county residents about syringe exchange programs and their concerns, so that we can address those concerns during program design and implementation. Over the last year, we've also hired 2 staff to support our EHE efforts. The first one was a health information specialist who is providing additional support to the county's HIV planning group to increase the group's ability to plan for EHE-related efforts, and a community health program specialist, which is myself, and I oversee the planning and implementation of our 2010 EHE efforts. During the first year of our project, we've also done a lot of planning and work related to RFP development for the procurement of services. So once finalized, they will be providing competitive startup grants for community health centers and other nonprofit healthcare providers to implement routine HIV testing in primary care, urgent care, and emergency departments. They will also be providing comprehensive testing, status neutral healthcare navigation, and linkage to substance use disorder treatment and mental health supports for persons who inject drugs, and develop and maintain a mobile application and resource guide to provide information and resources about medical and support services available for persons who are living with or who are at risk for HIV. Next slide, please. So as we look into year 2 of the project, we'll be prioritizing several things. The first one is the continued development of comprehensive wraparound services for people who inject drugs. The second one is developing a set of comprehensive HIV care and prevention services that address the needs of transgender communities across San Diego County. So even though we're in the beginning stages of the development, this set of activities has already been informed by a series of community engagements events done over the last 2 years. And some of the activities that we're considering include developing a workforce development program that addresses job training and placement needs, partnering with county community health centers and other nonprofit healthcare systems to support the development of trans-responsive systems of care in primary care settings, and expanding long-term partnerships with grassroots organizations to address social support needs, such as housing. Last but not least, we'll also be prioritizing the development of a set of peer-delivered mobile PrEP activities. So the goal of these activities is to recruit Black and Latinx MSM, as well as transgender persons currently utilizing PrEP to support community outreach and education efforts related to comprehensive testing, PrEP, and benefits navigation. Over the last year, and also thinking about year 2, we're anticipating that a lot of our technical assistance needs will be centered on the project's harm reduction and HIV workforce development activities. We've already had a number of conversations with our technical assistance providers and are really looking forward to taking advantage of all of the available technical assistance resources. Next slide, please. In terms of partnerships, we've had the opportunity to work with regional and county partners over the years through several joint projects and funding opportunities. Some of our standing partnerships include collaborations with CDPH Office of AIDS and some of the counties from the California Consortium. More locally, we've had the opportunity to collaborate and work together with key stakeholders such as the county's Ryan White network of providers and San Diego Center for AIDS Research at UC San Diego. For our Ending the HIV Epidemic project, we're looking into expanding and strengthening our community partnerships to reach populations with HIV-related disparities who may not have access to clinical and support service in traditional ways. So to do this, we'll be expanding our partnerships with grassroots and community-based organizations that provide culturally, linguistically, and trauma-informed care. So we're hoping that by implementing some of the activities mentioned earlier and continuing to evolve the local community, we'll be able to reach and engage new voices in the work that we are doing. Next slide, please. So before closing our presentation, we also wanted to share a key lesson learned. Ours deals with building on key strengths. I think it's very important to listen and recognize some of the work that has already been taking place and find ways to support it and collectively build on their legacy, resources, networks, relationships, and most importantly, trust. I think doing this has allowed us to gain a deeper understanding of local issues and has allowed us to work more closely with local stakeholders and community groups to better understand and address some of those key structural issues surrounding HIV. So I would definitely encourage communities to continue listening and work with communities as partners to support, identify, link, and retain folks in care. So that concludes my presentation. Thanks again for your time this morning. I'll now pass it back to Elena.
Wonderful. Thank you so much, Felipe. So now we've heard updates from our 6 California Consortium counties, and next we'll hear from San Francisco. I'm pleased to introduce Hannah Hjord, HIV, HCV, STI Behavioral Health Coordinator and EHE Coordinator for the Community Health Equity and Promotion Branch at the San Francisco Department of Public Health. Thanks for speaking today, Hannah.
Thank you so much, and good morning, everyone. I'm really happy to be here to share San Francisco's updates. Next slide, please. So this slide was provided by my colleagues at the HIV Health Services and lists some of the HRSA-funded EHE successes. I want to first just note that San Francisco's priority populations for these efforts are Black African Americans, Latinx communities, trans women, people experiencing homelessness, people who use drugs, and people with a history of incarceration. So on the care side, we saw improved stability of medical care of people who previously experienced homelessness, provided validating trans-affirming care to trans women, and were able to fortify trusting relationships that led to viral suppression and also satisfactory gender-affirming care and surgery outcomes. For some clients, the shift to remote services during COVID worked really well and helped reduce barriers. And while many services shifted to telehealth, all of our EHE programs, they continue to provide on-site services so that clients who wanted face-to-face appointments could get them. Next slide, please. So these are some of our CDC-funded EHE successes. We funded 8 community advisory processes, or CAPs as we call them, to do really deep focused community engagement with our priority populations. And the goal of the CAPs is to engage communities in ongoing, innovative, and meaningful ways. And these CAPs inform all of our activities, and at least 50% of the funding goes directly to community members for their time and expertise. Another success is enhanced workforce development opportunities. We are in the process of developing community health leadership initiative called Chile that is focusing on HIV, Hep C, STIs, racial equity, harm reduction, and supporting community members in their public health careers. And Facente Consulting is leading this effort. We are going to hire a lot of new positions and are working closely with our Human Resources Department, the Office of Health Equity, and the Office of Anti-Racism and Equity, because we really want to hire, support, and retain staff from our priority communities. Next slide, please. This slide was provided by San Francisco City Clinic, which is San Francisco's municipal STD clinic, and it lists some of their PS 2020-10 Component C funded successes. So Project Expand and Elevate relaunched a phone-based PrEP express visit program and express visits for asymptomatic screening. They did research and planning toward implementing viral load testing, and they did a PrEP retention survey in October of 2020, which had a low response rate, but at that time, 1/3 of the respondents said that they were still on PrEP. And then they pursued EHE partnerships and did public health detailing and technical assistance focusing on sexual health. Next slide, please. Some key innovations and upcoming activities on the HRSA side include low threshold drop-in services and real-time availability of remote psychiatric consultations, and trans-specific clinic times and days, and a one-stop shop with on-site dental care and also hormone therapy as primary care. Also mobile medical services with street-based medicine overlap and support services to assist folks in keeping their housing. There's an upcoming home-based mobile blood draw program and outreach and outpatient substance use treatment at homeless encampments. Next slide, please. Other key upcoming activities for all of our funded efforts include using HRSA and CDC monies to jointly fund status neutral services. This will include navigators, an expanded street-based medicine and outreach team, and services will be for clients living with or at risk for HIV, Hep C, and STIs and overdose and COVID, and will include status neutral, sex positive, whole person care messaging. We're also jointly funding mobile contingency management services for people experiencing homelessness, focusing on folks who smoke fentanyl. And this includes incentivized street-based outreach, brief intervention, overdose prevention, access to drug testing, and referrals to services. And we're doing more regional planning with Alameda County Public Health Department, East Bay getting to zero, San Francisco getting to zero to develop a regional PrEP approach and messaging. Next slide, please. So some opportunities to get involved and stay informed include participating in our CAPs and or our steering committee work groups. So our steering committee includes representatives from our HIV Community Planning Council, San Francisco Getting to Zero, the HIV AIDS Provider Network, and Hep CSF, the Black African American Health Initiative, Office of Transgender Initiatives, and the HIV Frontline Organizing Group, or FOG. Facente Consulting is working with the CAPs to develop some community-facing materials that should be released soon. And we're also hoping to create an online community and website sometime soon. And we're planning a series of town halls where the CAPs are going to present their innovative community engagement. And for any of these opportunities, you can email me to get involved. Next slide, please. This is my contact information and also the link to our San Francisco plan. Thank you so much.
Great. Thank you so much, Hannah. And our final speaker today is Saron Salase, Health Program Analyst and EHE Diagnose Pillar Lead with the Division of HIV and STD Programs at the Los Angeles County Department of Public Health. Thanks for joining us, Baron.
Thank you. Good morning. Next slide, please. So for the LA County overarching strategy to achieve the overarching goal of the EHE initiative across the board includes addressing and eliminating health inequities, addressing and dismantling racial inequities that are at the root of HIV and related pandemics, focusing on the communities most impacted by HIV, and adopting a client-centered people-first approach. And so the priority populations of the LA County plan were determined by local data and include Black and Latinx men who have sex with men, women of color, people who inject drugs, trans folks, and people under the age of 30 years old. Next slide, please. So there's a lot on these slides, so I'm just gonna pick and choose in the interest of time. Under the diagnose pillar, one of the core activities that we have been working on is expanding HIV testing in non-healthcare settings, and we've primarily been doing that through HIV self-test kits, which I think I've heard in every single presentation. So one way we've been doing it is similar to the other jurisdictions, is utilizing the partnership with Take Me Home, where clients can directly request test kits online. And in about 11 months, so from August to June, we have had 1,100 tests ordered through Take Me Home. And so we are hoping to increase our recruitment, our active recruitment, to increase that number, increase utilization, but also thinking through like increasing equitable utilization across the board and making sure our recruitment efforts reflect that. And then the other arm of our HIV testing self-test kit distribution program is providing kind of bulk amounts of test kits to community partners so that they can distribute the test kits to folks who think they can benefit from HIV self-test kits. And so that looks like adding, giving this resource to folks who are already have contracts with UHSP to provide HIV testing. So just to integrate it into their work for folks who could benefit, and then also really seeking out community partners, some of which are non-traditional, who may or may not actually do direct HIV work, but whose either priority populations or sort of work converge with kind of our mission around this as well. And so we've distributed 5,000 test kits in partnership with in collaboration with our community partner. Next slide, please. So really wonderful highlight of our treatment pillar is our recently launched Rapid Linkage to Care pilot program. We have partnered with Wesley Health Centers in LA and Hollywood, Pasadena, and Hacienda Heights, so 3 locations. So they're our clinical partners. And we also partnered with Lacata and Reach LA, who are our HIV testing partner, to be able to pilot this program. And so protocols have been developed, they've been shared. A warm line has been created, so GHSP staff member kind of staffs the warm line, and providers can call in to get support, whether that looks like the staff member attending the appointment with the client, or it looks like sort of navigating barriers for the client or sending transportation to them. So that's what the warm line is meant for. And then we're also working to hire navigators at GHSP who would be able to work the warm line in addition to the existing staff, so that it's sustainable, but also so that we're able to expand the program beyond the pilot. So a few more pieces to the treatment pillar, a few more updates include our emergency financial assistance program, which is a program where eligible folks living with HIV can request up to $5,000 to support their emergency needs. We have over 35 providers who have been trained, and these providers are meant to recruit and support folks in filling out the low barrier application. We've received 323 applications, 217 have been approved, and the rest are either pending, have withdrawn, or have been referred to a more appropriate program. Under the mental health bucket, we're working on a Ryan White mental health assessment. We're also working with the Department of Mental Health, collaborating to increase services at 3 key locations. And something I'm really excited about is that we're exploring the potential for a region-wide telemental health service with a particular focus on linguistically competent, providers for monolingual Spanish-speaking community. Next slide, please. So from the prevent pillar, what I want to uplift is PrEP landscape analysis. So we have completed about a third of the interviews. There are about 100 providers that we want to reach out to get some information, just kind of get a comprehensive picture of whether or not they're comfortable providing PrEP, whether they are, providing PrEP. And once that kind of data is complete, we're going to work with these providers to, one, we'll look at the data to determine next steps, but we are definitely going to work with the providers to provide TA for folks who aren't comfortable or folks who aren't already providing PrEP. Another thing I want to uplift is we're working with 3 of our PrEP centers of excellence to support their teleprep efforts to increase retention and engagement in their programs. We're also working with the Substance Abuse and Prevention Control Program to increase the capacity of the syringe service program to provide HIV prevention programming to people who inject drugs, including providing them with directly with like bulk supplies of HIV self-test kits to distribute to their clients on the spot. Next slide, please. And then finally, the respond pillar. So we're working on a cluster detection and response plan to refine processes in real-time cluster detection and response. We're working to increase the capacity of partner services by hiring public health investigators, both for partner services as well as for our linkage and re-engagement program. And finally, we are working on building surveillance infrastructure to enhance the identification and assignment of new HIV cases to staff for timely follow-up and partner services, which is primarily being accomplished by procuring a new data system. Next slide, please. So these are resources. I will drop it in the chat. Please sign up for our listserv if you want to find out more updates, kind of more in real time. Thank you. That's it.
Great. Thank you so much, Saron. So we are at 11:27, and we have heard some great updates from our Department of Public Health partners at the state level, as well as across our EHE Phase 1 counties. I know we just have a couple minutes left, but I wanted to get to one question that came into the Q&A box. So I'd like to invite our panelists to turn their videos back on just for a few more minutes. And I'd like to ask this question, which is, how are programs coordinating ending the HIV epidemic efforts and PS 18-1802 efforts? So that's the funding that is to help folks implement a comprehensive HIV surveillance and prevention program. So I'm wondering, Steve, maybe if you could kind of get started on speaking to Alameda's approach to coordinating kind of that funding.
Yeah, thanks, Helena. I was actually just responding in the chat feature, or the response to the question. So there's 2 levels of coordination. There's in between the Public Health Department and the Alameda County Public Health Department. And so we have a series of ongoing meetings that address that, but I think Lori knows about that. So I think she was asking more about external coordination. So with that, we specifically are working with East Bay Getting to Zero to help convene nearly quarterly meetings with agencies funded by the local health department, by the state, by CDC, because the CDC has some direct funds coming in, as well as agencies now funded for prevention services under HRSA grants. So East Bay Getting to Zero is having a meeting with all these providers so we can have a better coordinated effort to how testing is being done in the county and PrEP is being done in the county. So that's a big lift, and that's why we actually contract with East Bay Getting to Zero to do that, because Dr. Wong and Dr. LeBega actually have the reach to reach providers that we couldn't reach. And then we also contract with Cardia Services with us to help with some of the data analysis for agencies funded directly by the county to do either focus testing or routine opt-out testing. That's something we contract with them specifically to help them identify who they're reaching and who they're not reaching, maybe change some of their outreach strategies.
Thank you so much, Steve. Matilda, how about for you in Orange? How are you approaching these two funding sources?
Sure. So I can say that the funding is for the administration of that, the 18-1802 and 20-2010, and all other EHE related funding, for example, the 20-078 from HRSA as well, is coordinated centrally in Orange County, and that's through the unit that I oversee, HIV planning and coordination. And that's an advantage in the sense that we're really able to see the breadth and depth of the programs and services, and also identify any gaps or opportunities. So we were able to, based on our 18-1802 work, moving into the planning process for programs and services for 2020-10, really leverage that knowledge and that insight in the sense that we can see where there were some opportunities. And I should also highlight that the work of the Integrated Plan Committee, which is the EHE Steering Committee, and really representative of diverse community-based providers that some which are 18-1802 funded, that can really speak to those gaps and those needs in the community, where we could leverage and build on the work that's happening that's funded through 18-1802, that we can in turn support with 20-10 funding as well.
Thank you so much. So we are out of time for today, but I do want to note, if folks have additional questions, please feel free to send them along to me, and I'll make sure to connect with our awesome panelists to get those responded to. We will be providing all of the slides and the recording of today's session on our EHE Regional Response webpage within the next week. And I'll also be sending an email later today with resources from the session and a brief evaluation, so please do fill that out. We really appreciate your responses on that. And I just want to thank all of our amazing panelists one more time. Thank you for taking the time out of your extremely busy days to come share updates with us. And thank you also to all of our participants for your just really wonderful participation on today's call. So thank you, everyone, and have a great afternoon.
Thank you.